Margolis Center at Duke University is about using better evidence and developing new ideas to improve health policy to get to better health, lower costs, and an innovative healthcare system and a healthier population. The Margolis Scholars are the linchpins to making this happen in the future. They'll be able to experience the diversity of programs at Duke that are currently aiming to transform healthcare. They'll be able to develop the skill sets that are needed to be leaders in healthcare in the future.
I got interested in the field of health policy far before I knew what health policy was. So in undergraduate here at Duke, actually, I worked as a student health educator. And in doing that work, I really felt like while the one-on-one interactions were interesting and useful and helpful to people, that there was sort of a bigger question of what was going on in their groups of friends or the kinds of healthcare that they were receiving.
I was working for the government where I was developing and implementing health reforms in the province of Punjab. And I was working with local communities. I was basically researching why the healthcare system is not working, where it's failing to deliver services, and how we can improve it.
Our goal with the Margolis Scholars Program is to make sure that whatever your primary background is, you're going to develop the skill sets that you need to confidently make a difference in changing policy and in being prepared for and able to lead in implementing the new steps in healthcare policies that are coming.
Duke is not only a place where you can get a really foundational knowledge base and skill set on how policy is made, how it's implemented, and how it's evaluated, but Duke is a place that's really committed to interdisciplinary learning and recognizing that public policy doesn't operate in a vacuum.
It's great to be able to dive right into something that I'm interested in. Everybody here has been really helpful, really passionate about what they do, and it's just been great to have everybody here at the Margolis Center as a resource to connect me with either people researching in the area that I'm interested in or people who are experts.
As a Margolis Scholar, I'm most excited about getting to participate in really cutting-edge research. This semester I'm working with a great team in both DC and in North Carolina, researching Medicaid incentive programs for healthy behaviors and trying to understand what other states have done.
I hope that one of the most valuable parts of the program is just the connections that it provides. It seems that the center has a lot of opportunities here on campus with faculty to get to know faculty who are doing really important research, but also connections in DC and within health policy.
It's an area where the skills that you need are going to be diverse, but there are really good opportunities here at Duke to put together that skill set. So we do want to hear from you. We do want you to find out more about the program. We do want you to think about the broad systemic changes that you could lead. And we're really looking for people who have a combination of these skills to lead in healthcare, but also the heart behind it.